I am going to demonstrate two forms of Moxibustion therapy. Moxibustion therapy, which is called Moxa for short, is heat therapy. Heat therapy with burning herbs. This is a mugwort stick. The treatment puts heat into the patient's body. These are about as large as a cigar. I get it all red and hot. And one of the things that's important to do when you're doing Moxa therapy is to ask the patient when they feel the heat, because obviously could be a burn. We never burn the person. We just want them to tell us when it feels hot to them.
I can feel the heat.
I put my hand next to it also so that I make sure that it doesn't get too hot. And for example, for knee pain, what I would do is do the Moxa therapy on different acupuncture points around the knee. So the patient tells me if it gets too hot. In China, they actually do burn the skin, but we just put it close to the skin so that the heat gets into the body. So Moxa therapy basically just takes a few minutes. For pain, I want to heat up the area because studies show that the body, when it's trying to heal itself, it responds a lot better to heat than to cold. And these treatments can be done in a few minutes. They can also be used for general health. For example, kidney 1 at the bottom of the foot is a powerful point that maybe if the person is deficient or has fibromyalgia or chronic fatigue, I would want to do the Moxa on the bottom of the foot. But we can do it in a number of different places. So that's called stick Moxa. We also have something called stick-on Moxa. There's adhesive on the bottom of this, and I light it. You can light it before you put it on the person's body or after. I like to light it beforehand. And then the adhesive just goes right on the body. And you leave that on the person's body until it burns down. And again, the person can tell you if it gets too hot. Generally, the way these are designed, it's not going to get really hot on the person, but it will add a little warmth to the acupuncture points.